Well, welcome to the Pulse Podcast, everybody, and we are here with Holistic Pain Management. As you know, they've been with us for a while, but we have a new provider, and we're so excited to introduce you to Jess. And can you tell me a little bit about yourself?
So I am a nurse practitioner that grew up in Western Kansas, in between like Kinsley and Stafford area. And I went back to school to become a nurse practitioner. I did some time in urgent care in Dodge City and then moved to Newton and worked urgent care there. And then I got the opportunity to work for Holistic Pain Management, which was really exciting because it brought me back to my roots of, you know, the rural health care and the patients that brings. So.
That's perfect. And can you tell me a little bit about Holistic Pain Management, like what you guys do?
Yeah, so we really focus on chronic pain management. So anything that's, you know, really over, 6 weeks to 3 months is where we come in. So people that, you know, are having any sort of like low back pain or neck pain, we can help treat with like joints, and any sort of like nerve pain that people may have. So there's a whole list of things that we can encompass. It's just, coming to talk with us and kind of dig deep and really figure out like where that pain is coming from so that we can kind of help manage it for you.
Perfect. And then Karlee, you are the marketing person, is that correct?
Yes.
Okay, well, can you tell me about the partnership that we have?
Absolutely. So we spend a lot of time here in Anthony at Patterson Health. We partner not only, in the marketing aspect, but also when Jess refers patients to physical therapy, we do that primarily in-house here. So we have that partnership referring to each we want to refer to within the facility as much as possible.
So what services do you offer to people? I know you were touching on chronic care and stuff like that. So what services do you guys offer?
We're interventional, so we're procedural based. For the chronic pain, we don't typically, do a lot of like narcotic pain, which is kind of what people think of when they hear pain management.
Mm-hmm.
But that's not really a service that we touch on. We'll help people, in short term until we can get them, better relief with a procedure of some sort. But we're trying to really get to the root cause of it and figure out where the pain's coming from instead of, only, treating it with medications and things.
When somebody comes in for the first time, what should they expect during their first appointment?
That first appointment, it's pretty lengthy. It's going to be at least an hour, and we really just sit down and we just kind of listen to the story, things that have happened during their life, things that they can't do anymore because of their pain. People just assume because you're getting older that you're going to have pain. But if it's affecting your ability to do the things that you deserve to do, then, coming in to speak to us and so that we can figure that out and order imaging if we need it, referring to physical therapy, chiropractic, care. There's so many resources that we can do to try to help, get that pain level to a reasonable place.
How do you partner with like local providers and hospitals and communities that it just kind of benefits everybody?
It's really nice to be able to work with the family physicians in hospitals. They see them, they're frontline, they really know their history. And so when they come to us, there's good resources to be able to go back and talk to the providers and get their viewpoints, on some of those things. And physical therapy and, the chiropractors in the facility as well, they're all just building that team to help, to help the patient. So.
Definitely. And so if somebody wants to know more about holistic pain management and they're not sure where to go, where can people find more information?
Our website, which is myhpm.com, has a list of the services we offer along with our treatment options. Also has a contact us button if you want to schedule an appointment. you can directly call Anthony, Patterson Health Center, as well at 620-914-1200.
Yeah. And do people need a referral for an appointment, or?
No, you can just come in. No referral needed to be seen. Yeah.
Well, thank you so much for joining us for the Pulse podcast. And once again, this is Holistic Pain Management, and we are so excited to have them in our facility. So thank you so much for being here.
Thank you for having me.